that of a new India. The promise is that of a nation making rapid strides in economy, on the world stage, in sport, in space technology. The hope is that of an economy that can touch $5 trillion in the next 5 years. Now, how does that sit with the shameful situation in Muzzafarpur Bihar, where more than 100 children have died due to acute encephalitis syndrome or AES? As the Bihar government ducks for cover after the outrage, the question is, can we really hope to achieve our dreams if we can't ensure the basic rights of the most vulnerable among us, our children?
नीतीश कुमार आए, हम लोग उससे मिले नहीं, पब्लिक से मिले नहीं, ब्रेक के अंदर क्या गए, कार के तरह आए और चले गए। उनको मुख्यमंत्री मानते ही नहीं, वो गिरगिट है, पलटू चाचा है।
Bihar Chief Minister Nitish Kumar is facing the heat after more than 100 children have died due to encephalitis in Muzzafarpur. This is a district that has been reporting cases of acute encephalitis among children since 1995, and yet there is no solution in sight. Union Home Minister Harshvardhan is also facing tough questions on the disease that takes lives of vulnerable children every year.
That super specialty center is already in the advanced process of construction. I have myself gone and seen that on.
5 years you could not
yes.
deliver that, sir?
You see, whatever has been done, I have seen that. Whatever is required more, I have advised them, and we have promised every possible support to the state government.
Encephalitis is an inflammation of the brain caused by viruses and bacteria, and the most vulnerable are young children and the elderly. The disease is preventable if the spread of mosquitoes is controlled, malnutrition is avoided, and clean water is ensured. The most successful methods of prevention are vaccinations. Between 2008 and 2014, there have been more than 44,000 cases and nearly 6,000 deaths from encephalitis in India, particularly in Uttar Pradesh and Bihar. The most devastating outbreak was in Gorakhpur district in 2005, which took 1,500 children's lives, and research shows that 1 in 3 eligible children missed encephalitis vaccines in Gorakhpur division during that time. As the usual blame game sets in after the latest outbreak, a few key questions emerge. Can a nation that prides itself on making rapid strides in every sphere continue this apathy towards a preventable disease? Are successive governments failing in tackling the issue with its complete might only because those that are hit hard belong to the weakest and most vulnerable sections of society? Can we really hope to become a $5 trillion economy and talk of dreams of development without tackling issues of public health first? And to speak more on this, I'm joined this evening by K. Sujata Rao, former Health Secretary in Government of India, K. Srinath Reddy, President of the Public Health Foundation of India, and Purnima Menon, Senior Research Fellow at the International Food Policy Research Institute. Welcome to all of you. Ms. Rao, let me begin by asking you why we must hear of these deaths year after year. There are certain areas in the country which are more prone, but just to understand correctly, is there nothing that governments can do to prevent this extent of calamity and outbreak?
Of course, as you yourself said, it's a highly preventable disease. And there is no excuse for these infectious diseases to occur in such large numbers in a country that is seeking to, be claiming to be one of the fastest growing economic power in the world. Now, the whole, what is happening today in Muzzafarpur is nothing but symptomatic of the total collapse of the primary healthcare system. And it is a disease which affects the poorest, which in other words is those children who are hungry. Now, when they come up with these with these causative factors being eating lychees and so on, why would a child eat lychee and not have an evening meal is because they are sleeping hungry and they get therefore toxic and they get sick. Now, the problem here is, you are saying it's AES, but there are 2 or 3 theories floating, which also means that we've still not got a grip on why this kind of brain fevers are occurring in Bihar and UP in particular. So the promise that we should do much more research, get to what is the root cause of this disease, also needs to be definitely addressed. But the moot point is primary care, primary care, primary care, comprehensive primary care, and attacking malnutrition. Malnutrition is one of the major causes of a huge amount of morbidity and mortality in our country. And till we address that, it's disgusting that 36% of our children in our country are malnourished. That's inexcusable. So these are diseases of the poor. And do we care? It's a good question. I don't know. It seems to me that we don't. So I love the way you've contextualized it within the this debate within the context of economic ambitions that we have.
No,
I think it is time that the government, central and state government begin to, and let me also say, though these are diseases of the poor, infectious diseases don't know caste, creed, religion or income status. I mean, even the most powerful Amit Shah got swine flu. So, it can affect anybody. Therefore, it is very important that we have a very comprehensive policy to get rid of these infectious diseases. 36% of disease burden continues to be communicable diseases. These are data and statistics which are absolutely unacceptable. And I really think government, both at the central and state level, should forget about Ayushman Bharat and health insurance, but to more focus on the wellness clinic component of Ayushman Bharat and get down to primary care.
I'm glad you brought up Ayushman Bharat, and let me explain why we have contextualized this, with our dreams of a $5 trillion economy. We, as a channel, track the India growth story, the rise of the Indian economy, and we're damn proud of it. But we'll have to take a very hard look at all of our claims and hopes and desires if we can't take care of this segment of society. Mr. Reddy, please put into context why it is fair, or is it not, as people are saying, to say that these are preventable issues, that it's not as if these 100+ children, and there's some figures which go as high as 133, there was really no need for this large number of children to die. Explain to us how it works and how it could have been prevented.
Well, there are several fault lines in our health system, as well as several flaws in our developmental pattern. If we look at why these epidemics occur, outbreaks occur, and how they ought to be responded to, then we ought to look at prevention, early detection and effective prompt care, as well as risk communication to the public and rehabilitation as required for people who have survived. Prevention is the critical element. Obviously, there are several causative agents. Some are vaccine preventable, but most are preventable by adequate nutrition and good sanitation. Sanitation is also important. If we have a situation with poor sanitation, inadequate clean drinking water, and highly malnourished children, for example, now we know that 48% of the under 5 children in Bihar, according to NFHS 4, are stunted. So they're obviously highly malnourished. And these children, when they fall ill, or if they have an attack of an infection, clearly their immune system is not functioning properly and they become highly vulnerable. So that is something that needs to be taken care of. And sanitation is very important, both in terms of preventing the vectors breeding and also the secondary and primary hosts, which could be pigs or waterfowls, or depending on the nature of the virus, they ought to be also attended to. But very importantly, as Ms. Sujata Rao said, most of these, even if they occur, ought to be detected and treated in primary care. What you really require is treatment of high fever, vomiting and convulsions when they occur, and adequate hydration and treatment of any electrolyte imbalance. Now this can and ought to be done, if not in the sub-center, at least at the primary health center. And certainly, even if advanced cases occur, they should be treated at district hospitals. But if you have a poorly functioning and equipped health system and very little spending of public financing on health, if you look at Bihar's per capita health spending, it is 1/10 of what Sikkim and Goa spend per capita. It is 1/5 of what Himachal Pradesh spends per capita on health. So you have a famished population and a poorly funded health system, then there is going to be an obvious problem. So we ought to take care of the social determinants of health, at the same time fix the fault lines in the health system and ensure that these people get care as needed close to home at the primary health care center. But in the first place, we should try and prevent the infections themselves.
Now, you're speaking about the spends of Bihar, and I'm glad you brought that up, because let's look at how much we as a nation spend as a proportion of our GDP on healthcare, which has been unchanged in 9 years, by the way, between 2009 and 2018, which was barely 1.02%. There has been a breakdown of how much that is per person per day, and comes to about 3 rupees per day. And we really have to ask ourselves if that's at the root cause of the problem. Even as Nitish Kumar today ducks for cover as his ministers are seen, you know, either taking a nap or asking for cricket scores in meeting. And of course, the anger against the politicians will be there. But Ms. Purnima Menon, let me come to the basic problems that have been outlined so far. If you have malnourished children and unsafe environmental hazards like unclean water, mosquito outbreak, etc., the setting is ripe for the spread of this disease, and it's not like we have faced it for the first time.
Yeah, you're absolutely right. In fact, as I was hearing the news coming in on this, I was reminded that in fact in 2014 there was a set of deaths in Muzzafarpur, and then following that a really thoughtful and rigorous piece of analysis done by a group of scientists both from India and from the CDC in the US that investigated that was published in the Lancet Global Health. There were key recommendations that were made on the basis of that very rigorous study, and one has to ask the question of whether the critical recommendations that were made, and interestingly, this study was done exactly in Muzzafarpur. This is exactly where the deaths occurred in 2014. The epidemiological investigation showed what the reasons were, provided recommendations for practitioners and for the government to act on. So I think one has to ask the question of what prevented either within the practitioner space or within the policy space lack of sort of adhering to that set of recommendations. I think the piece of good news from this is that I think some of the groups of those epidemiologists are out there again, I guess, trying to verify whether the situation that was identified or the causative factors that were identified in the 2014 outbreak are similar at this point in time. But the fact is, at sort of a base level, it's a perfect storm, when, and I think that's what you were alluding to, when you have this level of, high levels of malnutrition, when you have, hunger, and when you have children that, aren't getting meals, etc., the sanitation challenge as well, it really is a perfect storm for, for the spread of this and for individual children. Not just the spread, in fact, it's children who are malnourished are more at risk of dying from infection. So it isn't just that they're more at risk of being infected. It is that the risk of dying from an infection such as this is multiple times higher when children are malnourished. So it really is not just a perfect storm for the spread of the infection. It's also potentially a
may I just come in here, Ms. Menon, may I just come in here?
Under which you're likely to see
you're right.
deaths.
You're right. It is a perfect storm. It is a perfect storm. It is a set of conditions that have contributed to this, but it's not new. It's not new. It's happened before, like you said, 2014 in the same place. We've seen it happen in Gorakhpur.
Yeah.
Now, I want to ask, what has happened to the NPPCJA, which was the National Program for Prevention and Control of Japanese Encephalitis or virus acute encephalitis syndrome? There is a plan in place. So what's happened to that? Has that not been implemented at all? I think questions like these now need to be asked. Don't you think so, Ms. Menon?
So, you know, anytime there's a policy or a plan, one must always ask questions around the implementation. And in this case, it isn't, you know, it isn't just a plan to address a single vector. This is, you know, I think whether what's happening in Muzzafarpur right now is precisely Japanese encephalitis or is more, you know, the kind of acute encephalitis syndrome is something to be determined from the investigations. But if it is the latter, so if it is the acute encephalitis syndrome, which is, you know, that's likely to be more associated with this cluster of underlying factors, then I think it's not going to be controlled by a single vector control or a single infection focused setup. It will require a lot of different things to come together to resolve the sanitation conditions, to investigate, you know, what the levels of malnutrition are, what is going on with child feeding, you know, what is going on with the lives of people that makes it so hard for them to be able to feed their children in the evenings. I mean, these are communities under stress. You know, no parent is willfully not wanting to feed their children.
Let me bring in Ms. Sujata Rao. Yes, let me bring in
the situation, right?
Yes, yeah. Let me bring in Ms. Sujata Rao on that point as well, that there are plans in place. There is a plan in place for encephalitis at the NPPCJA, as I mentioned. You know, in Gorakhpur, they had a Dastak scheme after the outbreak over there. So the reasons are known, the solution has been identified, the plans have been put in place, and now when you see an outbreak like this, how should governments respond? Isn't this tantamount to criminal negligence?
That's a bit of a harsh word in the sense that, you know, right now I know the team there, whether it's the health minister or the health secretary are very hard-working people, and I know the health secretary is an outstanding officer. So I don't think he would have neglected it, but the scale of priorities that the central government and the policy framework of this country gives, you know, more to Ayushman Bharat, more to reproductive child health programs, and so on, the kind of focus that infectious diseases must get. You know, the vigilance has to be 24/7, 365 days. There's nothing called you've got over a particular disease. Even polio has been eradicated for so long, but we still continue to do polio surveillance and continue to vaccinate our children. So, so in this particular case of Bihar, there are several multiple factors going on, and I would say perhaps there has been some amount of neglect not in having forecast the fact that given these conditions and given this history, much more greater care should have been taken, largely because Bihar also over the years seems to have developed a good social capital. Their self-help groups are very, very active. The women are at the village level are very active, and they could have been used to disseminate this kind of information, and the convergence of programs largely related with food should have been implemented well. The problem with the health department is that we tend to only look at sickness and the treatment. We are not giving enough attention to prevention and to the social determinants of disease. This is where the failing of our strategies are, and I think the sooner we recognize the better. Secondly, one thing I would like to say is I'm a bit sympathetic to Bihar in the context that you know very well that per capita income is 5 times lesser than, say, Gujarat. And it is a poor state. The most poor live in that poor state. The infrastructure is weak. They have a long way to travel to come up to the level of Tamil Nadu or Kerala. This kind of an epidemic, if it occurred in any of the southern states, they would have been able to arrest it quite immediately. So the conditions in Bihar are much tougher to show results in. Having said that, yes, I would agree that they should have taken much more, paid much more attention to infectious disease outbreaks. And I think that needs to be the single priority for Bihar. I mean, not only just AES, you're not looking at the Kala Azar that is eating up the poorest of the poor in Bihar, and we still haven't eradicated that disease. So I think in Bihar, it's a social determinants, priority for primary care, priority for infectious disease control. These are things where they should really focus upon. I think the policy has to be corrected by the government in Bihar, and this kind of focus needs to be given along with the resources.
No, absolutely. Bihar is one of the Bimaru states. There are high levels of poverty in the state, etc. The socio-economic conditions are known. But on the other hand, since these are known, there should have been a larger focus. Mr. Reddy, you were making the point about how much Bihar spends on healthcare.
Yes.
You know, and I want you to come in on that point, because today we're speaking about it in a broader perspective as well. What national healthcare plan are we speaking about if we can't prevent this? Ms. Sujata Rao has brought up the issue of Ayushman Bharat. I want you to respond also in the context of a very ambitious healthcare plan like that. Do you think we need to get our priorities straight?
Certainly, we need much greater amount of public financing for health, but especially much of it needs to go into primary health care, in strengthening the health and wellness centers as well as other components of the primary health care system. There is no doubt about it. But one of the most neglected areas is the health workforce. Even if you build infrastructure, if you do not have adequate number of community health workers, nurses, nurse practitioners, and other allied health professionals, apart from basic doctors, then you are not going to be able to deliver services. And even when we are trying to find out whether this is a one virus or another virus, or whether it's a leachy toxin or not, you need good epidemiologists. And to look at mosquitoes and mites, you need good entomologists. So our investment in the health care workforce as well as in the public health workforce has been extremely limited. And therefore, we need to bring in those human resources into play, apart from ensuring that we are investing more in strengthening infrastructure, making the ready availability of drugs and oxygen and other supportive elements easily available. I mean, we have actually all of these to attend to. Building large hospitals in mega cities is not going to be helpful. We ought to take healthcare into the actual front lines. And that is where the increased public financing has to focus, as well as ensuring that there is a multi-skilled, multi-layered and motivated health workforce readily available around the year. We cannot respond only to emergencies. We need to build a stable healthcare system which can function well in a steady state.
No, absolutely. Let's talk about what, as a national government or as a national, at the center, what the focus should be. And Ms. Rao, why don't you come in on that?
Well, I just wanted to quickly say one thing, that even in the central budget, sorry, are you asking me or Purnima?
No, I'm asking you. Please go ahead.
Hello?
Yes, I'm asking you. Please go ahead.
Okay. So, even in the central budget, we are barely spending 10% on real primary care, remove the little bit of the RCH. So that's the level of priority we are giving even in a central budget. And let me tell you one more thing. Infectious diseases, not just health is a state subject, but infectious diseases comes under the concurrent list. That means the central government and the state government both are accountable. So I do think this is an opportunity for central government to increase its budgets and really spend the money where the disease is. And that's where they have to make a differential policy where much more resources and much more strengthening of the basic primary care infrastructure, beautifully described by Dr. Reddy, on those lines in these northern states which account for 2/3 of maternal and child deaths. And unless and until that is done, I'm afraid these kind of deaths will continue to take place.
Absolutely. I want to thank all of you for joining us in this discussion. And again, let me put it into perspective. We are hoping to be a dominating global player in the next decade. We are talking about a demographic dividend. Well, this is the demographic dividend. If our kids and our most vulnerable malnutrition children are not given a chance, then what is the point? We really have to think about that. And as I take a short break, I want to just play out these pictures for you, which have enraged people even more. And this is about ministers and their apathy. You're seeing Mangal Pandey, Health Minister of Bihar, who on Sunday looked more concerned about the India-Pakistan cricket clash. He was heard asking, "Kitne wicket gaye?" while he was attending a press conference on these deaths. On the other hand, Minister of State for Health Ashwini Kumar Chaubey was seen taking a nap during the press conference. Afterwards, he said, "I wasn't sleeping, but I was thinking." Well, I hope they all wake up. Wake up, because this is really something, and it's a shame. We cannot afford to ignore it.